listening to 1853 The Gator Good, the hottest healthcare radio talk show in Gainesville. Stay tuned for today's talk on an important wrong site amputation malpractice case. I am Olivia, and today I will have with me Justin, Leah, and Allie. And we are reporting from 1853 The Gator Good, leading the way for the Gator Good. Today's healthcare topic will focus on a brief description of the malpractice case, what the leadership team did right and wrong, what this particular case helped change in management today, leadership skills to help prevent further cases like this, how planning and leadership is important, and the big picture of leadership's impact in healthcare. Healthcare workers, whether you're a doctor, nurse, physician assistant, or whatever your role is, people expect healthcare workers to be perfect. No mistakes are allowed. Death is not allowed. But, my friends, we all die. All this stress is being put on our healthcare workers, but they are humans. They make mistakes. However, mistakes in this profession can really be crucial, so leadership and management is so important. In 1995, an imperfection in healthcare appeared. Dr. Rolando Sanchez of Tampa, Florida, 50 years old at the time, was scheduled to perform a right leg below the knee amputation of Mr. King, who was Dr. Sanchez's diabetic patient. Now, we must note that Dr. Sanchez's license had temporarily been suspended in July of the same year. So 2 months prior, he had amputated a woman's toe without her consent at a different hospital. This was known as the Schuler case. Was this information disclosed to the patient? We are not sure, but it is very unlikely. On the right, you can see the actual newspaper release for this case at its time. The title says, "Doctor who cut off wrong leg is defended by colleagues." So you can already see the ethical dilemmas coming into play. So, let's just dive into where it all went wrong for patient King. During pre-operations, the OR blackboard that lists the day's surgeries and surgical report mistakenly listed the removal of King's lower left limb rather than the actual limb that needed amputation. The patient's surgical consent forms had the correct information, but doctors were not required to check them as a protocol during that time. So, Dr. Sanchez prepped King's lower left leg to be cut off since the surgical board stated so, and the surgical team assisted him. There patient King laid, unconscious, putting all his trust in the surgical team. The surgeon found out he was amputating the wrong leg when an operating nurse checked some paperwork midway through the surgery. Tendons, muscles, ligaments were already torn, so Dr. Sanchez felt that he had no other choice but to finish the procedure. So by the time the surgeon noticed the issue, it was too late in his mind. I'm going to read to you the conversation that happened post-operation between Dr. Sanchez and Mr. King. Dr. Sanchez walks into the patient's hospital room shortly after the patient started waking up. Dr. Sanchez looks at the patient and says, "We have removed your left leg. How are you doing? How does it feel?" Mr. King looks at the doctor confused to say, I thought we were going to do the right. Dr. Sanchez then replies with, "That's right, but we did the left." Could you imagine how this patient must have felt? Angry? Helpless? Or even distraught? So many ethical rules were broken. However, who really was to blame? Was it the surgeon that read the board correctly? Is it the OR nurse that wrote the wrong leg on the board? Is it the management or leadership team that didn't set enough protocols into place to avoid these types of situations? Or was it the organization as a whole to blame? I think I want to hear what Allie has to say about what went wrong in this malpractice suit. Now to you, Allie.
So what's the big issue? To start off, the patient did not give consent on this procedure being performed on them. The patient was fully expecting to wake up with their right leg amputated, but awakened to their own horror of the wrong limb missing. In addition, the patient still needed to have another surgery procedure done to amputate the correct leg. This is a huge ethical issue as their autonomy was violated without their consent and was out of their control as they were relying on the surgeon to perform the procedure correctly. So what is now the outcome for patient King? Well, eventually, King's lower right leg was amputated and at a different hospital. King also now has to live the rest of their life out as a bilateral amputee. King eventually went to court with this case and hired Steve Rothenberg, an attorney for the Agency for Healthcare Administration. Rothenberg stated that there was no excuse and felt in King's case it was most certainly the surgeon's responsibility to carry out his duty and operate on the correct leg. Michael Blazek, Sanchez's attorney, stated the Board of Medicine should consider other people's mistakes contributing to Sanchez's errors. In the end, King received a settlement of $900,000 from University Community Hospital and $250,000 from Sanchez. This particular case has impacted today by implementing double-checking before any procedure or medication administration. To add on, surgical limbs must be marked while the patient is lucid, and patients must state their date of birth while healthcare workers are present in the room. A motto to go by in the future is, measure twice, cut once. This simple but powerful and impactful quote goes a long way in life and especially in patient care. Double-checking your work should always be executed. The patient's future you care for is in your hands. The dynamic cultural leadership model relates to King's case through its science and art of leadership and consistency. In this case, the hospital that failed to sever his correct limb lacked in this model in many aspects. For example, the surgeon lacked technical competence to check twice before cutting. In addition, he also lacked the emotional intelligence to show empathy and feel even some sorrow towards King. Knowing how to technically and handle the situation and network correctly so that issues such as King's case do not arise again. The Association of University Programs in Health Administration, or OFA, has 5 core competencies. The first one is communication and relationship management. Communicate clearly, create meaningful relations, and promote constructive interactions. The second one is leadership. This is create a shared vision, inspire, and motivate, while you also want to design and implement a strong organizational plan. The third competency is professionalism. You want to exhibit professional, ethical, and moral conduct. You want to also be a role model and set high standards for the organization. The fourth one is healthcare knowledge, healthcare policies and regulations. You also want to change in technology and innovate and be aware of labor and supply chain issues. The last competency is business skills, business management, accounting, human resources, marketing and advertising, and awareness of the competition. These all relate back to how healthcare is an important and engaging field. Without these 4 competencies, understanding a good healthcare system and having confidence in your field will just not be possible.
Our recommendations for future amputation procedures include the following. In the preoperative period, the patient and the family both confirm that the correct side of the body is being operated on, with verbal confirmation from the surgeon performing the procedure. This ensures that the patient consents to having the body part removed as indicated by paperwork documentation, verbal confirmation, and real-time communication with the doctor prior to being put under anesthesia. Along with these criteria, the surgeon and the others in the OR who are operating on the patient should additionally confirm the site of surgery. The surgeon should physically mark the site of amputation with surgical marker prior to operating and putting the patient to sleep. During the operation, all of the team members should confirm the site of surgery and have a checklist of things to verify prior to the surgeon making the starting incision. The timeout is what it is called when the checklist is gone through before a surgery is performed. These timeouts have information that verifies the patient's date of birth, name, surgical procedure to be done, and on which anatomical structure. Post-operatively, the best protocol would be to proceed by once again confirming the surgery site prior to and after the patient is woken up. The Donabedian Model focuses on the structure, process, and outcomes in healthcare delivery.
The idea is that by working on structures and processes and changing them actively, it should ideally improve the outcomes of healthcare delivery. This model could be useful in preventing malpractice in the healthcare environment by breaking down individual points to focus on and improve within the structural components of healthcare delivery. For example, patient education and making sure they are delivered the information they need to get well and take care of themselves once they are done with the doctors. Aspects of process could include how the flow of getting an operation occurs and clarifying the distinct steps that are included in the surgical plan. And then, based on this model, by improving these structural and procedural components for the patient and the healthcare organization's flow, we should be able to have outcomes that are improved overall. The lessons learned from the wrong side amputation include practicing and applying empathy when interacting with patients. Mistakes may occur, but it is important to deliver the information in a way that shows you understand what the patient is going through. It is important to address their frustrations and anger and give them time, space, and resources necessary to process the situation. Consequences that come with serious mistakes like these include destruction of professional reputation, financial stressors such as cost of settling, getting a lawyer, and losing a high-paying job, and issues with mental health follow, such as regretting, unforgiving oneself, depression, anxiety, self-doubt, etc. Responsibilities learned include that the provider must take responsibility for his actions and those of others who were under his direction in the OR. He was ultimately in charge of the surgery and failed to responsibly verify the information prior to operating. Some leadership skills for improvement include establishing organizational situational assessment, vision, mission, strategies, goals, objectives, and action steps to make the outcomes better. Improving these concepts is critical for great outcomes. In the wrong side amputation case, the healthcare organization needs to establish better protocol to follow. In addition, planning is absolutely necessary within leadership because outcomes are dependent on the plan being made. An organization cannot move forward without structural planning. Additional important skills for improvement are emphasis on situational assessment and environmental scanning. It is important to stay up to date on current changes within the organization and the environment you are in. This is an imperative for any health organization in this dynamic industry. Here are a few concepts about the big picture in leadership, which is the leadership process within the dynamic culture leadership model. The focus is on the science and art of leading dynamic organizations. Together, science and art provide the fact-based and social relationship aspects that are crucial in the leadership process. Facilitating communication is necessary in making communication flow easy within different levels of an organization. It is important to always be improving this. Strategic planning helps give the organization a foreseeable future to aspire to achieve. Decision-making alignment allows for the organization to reach the goals and meet objectives more efficiently. By making decisions with which the majority of leaders agree in the organization, it can help reduce potential conflicts. Employee enhancement is important in giving employees recognition for their work and contributions to the organization's success. As a leader, knowledge management and learning organization improvement are needed. Sharing this knowledge and knowing what to share is necessary. Learning how to improve the organization based on assessment of the organization routinely will help narrow the priorities of what needs to be changed. Evaluating and reflecting on the organization and one's leadership role in it is important to help the managers with their roles and continue pushing the organization to get better. Reflection is needed to help track the organization's progress over time. Retraining and retooling is a very good way to make sure that continuing education requirements are met and that leaders in the organization are up to date on knowledge, skills, and abilities that are needed in the dynamic health environment.
Next, we will discuss a few discussion questions regarding the current situation. As a leader, You are responsible for others' actions. As we saw with the amputation, the surgeon misidentified the proper leg. However, the nurse in charge of that day's surgery board also mislabeled the leg on the board. One may say that because the nurse failed to report the proper leg on the board, she should be held responsible for the situation. But before the patient even made it to the operating room, dozens of people had failed to check that this was the proper leg. The surgeon is responsible for making sure that these checks are conducted, as well as ensuring that they themselves are also aware of the proper surgical site. As a leader, the surgeon is responsible for their team and thus must also be responsible when errors are made, even if they alone were not responsible. The next discussion question is, if a situation cannot be reversed, how should a leader handle it? In medicine, a lot of what we do cannot be reversed. With this situation, there is unfortunately no way to reverse the amputation. However, how the leader handles the mistake and approaches the mistake to the patient will go a long way in how the situation will unfold. The surgeon failed to both acknowledge his side of the mistake and approach the patient in an apologetic and empathetic way. A leader should handle this type of situation by identifying where mistakes were made and ensure that those areas are redeveloped so it does not happen again. Self-reflection is also important when any mistakes are made. To avoid further worsening the situation, a leader needs to be empathetic and put the patient or client at the center of every decision going forward. This includes providing them with as many resources as possible so that our mistake does not further impact their life. The final discussion question talks about whether a physician should lose their license for making one mistake. Obviously, there needs to be punitive measures taken for any mistake in the health field, especially one as big as our scenario. I do not think one mistake should result in a provider losing their license. They should, however, have their license be suspended and forced to retake any certification examinations for their specialty. In conclusion, we determine that leaders are not held to the same degree as their substituents. They are the ones accountable for the actions of their group. The surgeon in our scenario, despite mistakes being made by other individuals, was ultimately responsible for the mistake that occurred. Leaders are responsible for the outcomes of the group because ultimately they are in charge of how that group functions and the processes in place for that group to work through. Which leads into the next point, that leaders are responsible for creating and adhering to step-by-step processes to ensure the safety of the patient. If a mistake was made, it was not the individual's fault alone. Rather, there was an issue in the process that the leader helped create. The leader must also make sure that this process is understood and followed by the rest of the group. Having these processes, like a checklist in our scenario, are there to protect the patient and the staff as well. If there is a crisis occurring, it is imperative that the leader is using effective communication to direct the group on what to do. The leader is the one who is looked at for answers, and it doesn't matter how qualified or knowledgeable the leader is if they are unable to provide the proper information in a way that the group or patient can understand. This can even be extended to the emotion the leader shows in a crisis. In our situation, the surgeon was unable to communicate what had happened in an apologetic and empathetic way, which ultimately resulted in the situation deteriorating more. Leaders are responsible for creating an organizational culture. In healthcare, it is important that the staff are encouraged to speak up when noticing any issues, even if those issues were caused or went unnoticed by the leader. When people's lives are on the line, it doesn't matter who notices an issue, just as long as it was noticed before it affected the care of the patient. It's possible that an employee in the situation may have realized that this was the wrong leg for amputation. But if the surgeon had created a toxic environment where lower staff members didn't feel comfortable speaking up, this could have caused the mistake to occur. This is why having positive work cultures is crucial to the success of any group, by allowing everyone to feel valuable to the team. These are our citations for the presentation, and we thank you for listening.